Welcome to Clause 8. I'm Eli Mazur, and today we're honored and super lucky to be joined by former Congressman Henry Waxman, who's, of course, one of the authors of the seminal Henry Waxman Act. Hatch-Waxman Act. I guess Henry Waxman Act would also work. So we're going to talk a lot about that today, and obviously a lot of people think that the Hatch-Waxman Act is responsible for what the generic industry is today, but it also provided incentives for the pharmaceutical companies to continue innovate. But before we do that, I want to, talk a little bit about your background. Both of your sets of grandparents immigrated from Russia. And even though you grew up in LA, you seem to be very aware of that. What kind of impact did that have on, your life or your career, knowing that your grandparents were immigrants?
My grandparents on both my father and my mother's side came from an area that was Russia when they left, but it's now Moldova. It used to be called Bessarabia, and my father's parents were from Kishinev, the big city. And Kishinev is famous for its pogroms. It had a terrible pogrom in 1903, captured the world's attention, and it was at that point where my father's parents decided to leave. They went to Montreal, Canada, rather than to the United States at first. But in 1920, they moved to LA. My mother's parents were from Bessarabia, but I don't think from Kishinev. And they went to Pittsburgh, Pennsylvania, and then to Los Angeles. So my parents met in Los Angeles, ironically enough, at the Bessarabian Youth Group. Called Landsmannschaften, where groups would get together from the people who were from a certain part of Europe, usually, and they were in the group of the children, those people. Most of the children were born in the United States, as were my parents. My family was Jewish, and I'm Jewish, and it also instilled in me a sense of responsibility to try to make this a better world and try to do things that would be in the interests of people. And that's why I went into politics, to try to do things, especially for lower income, middle income people who are struggling. I always felt the rich could take care of themselves, but government's responsibilities were to make this a more just, fair country, which meant giving people the opportunity to succeed to the fullest extent of their abilities. And if they couldn't do that, at least to make sure they had a safety net so we didn't take away the dignity of people who couldn't enrich themselves in business or other activities.
Your first run for office was against a longtime California assemblyman who was also a Democrat, and you ran against him in a primary. What gave you the confidence to run against him, and were you worried about losing to him, and how would it affect your future public political career if you did lose to him at that point?
I had been very active in California Democratic Party politics. I was chairman of the state Young Democrats. I knew a lot of the office holders and the assemblymen. We have state senators and state assemblymen. The state assemblyman was charged with bribery and acquitted. Yeah. And he ran for re-election after that and said he just wanted to make sure that he could win again, indicating that he was probably going to retire. There were so many people that ran against him that he ended up winning the nomination because you just need to be number one in the Democratic Party primary. 2 years later, I decided, well, maybe I would run after he left, but he didn't indicate he was going to leave. I went to see him. His name was Lester McMillan. He was a nice man. He was a liberal on a lot of civil rights issues, things like that. He was the champion against the death penalty in California. He was responsive to a district that was Democratic and liberal, but he was known in Sacramento, our capital, as a man who you could induce to vote the certain way when lobbyists wanted him to vote the certain way. I went to see him on the theory that if he quit, he wasn't going to do it in a timely manner. He'd probably do it and try to turn it over to one of his cronies. So I went to see him, talked to him, said, I'm going to run. And if I hoped not to run against him, but if he decided to run again, I would be challenging him. And he was very polite and very nice. He was a friend of my aunt and uncle who had a newspaper in the area. And I had met him before a number of times. He did run, but he didn't think he had to do much of a campaign. And we did a very active campaign and beat him in the primary.
What do you think gave you that confidence?
Well, I guess when you're young enough, the idea of losing doesn't mean so much. Freedom is another way of saying you have nothing else to lose. Okay. So I was 28 years old. I had just started practicing law. I got out of law school, still active in the California statewide Young Democrats. in Democratic Party politics. And I thought there was a chance, but I had to assume that I could well lose. But I didn't think that losing was a terrible thing, and I was willing to take effort and see if I could turn it around into a victory in which we won.
Not long after, in the wake of the Watergate, you actually became a congressman. Can you tell us what was Congress like at the time? And did you have any goals in mind in terms of, one day I want to be a chairman of this committee?
When I first got elected to the state legislature, I made a decision that I wanted to specialize in health issues. I looked at the different issues that would be coming up in Sacramento, and I thought health was really an important issue. It had an impact on a constituency which was quite elderly, and that everybody felt that government needed to be involved in healthcare for finding ways to stop diseases, prevent them, cure them, and to make sure that they had access to the healthcare that they needed. So I decided to focus in on health issues. I became the chairman of the California Assembly Health Committee, worked on issues there. And when I went to Washington, I wanted to get on the committee that dealt with the health issues, which was the Energy and Commerce Committee. You wouldn't think that it was a health committee, but they had the Health and Environment Subcommittee. I went on that committee at a time when everybody was concerned about energy in the 70s, because we had the boycott against the United States. The price of oil was going up dramatically. We were trying to figure out what to do about that. So, and a lot of people wanted to get on the committee to deal with those energy issues. I wanted to get on there primarily for the health issues. After 2 terms, in other words, 4 years, the chairman of the health subcommittee decided he would retire. He was a fine gentleman from Florida. His father had been a congressman, and he was a Democrat. Coming from Florida at that time, he decided he couldn't say he was a liberal, and maybe he never wanted to think of himself as a liberal, but he was a liberal. He was a progressive person and fought for good policies, but he decided he wanted to go make money and become a lawyer. The chairman, the man who later became chairman of the committee, John Dingell, his father was also a member of Congress from Michigan and was a strong supporter of Roosevelt's New Deal. So John Dingell thought of himself as a liberal, which he was on many issues, but on some of the environmental issues, he was not so liberal because he came from Detroit, Michigan, and he was always looking out for the interests of the auto industry, even though one of the major causes of pollution, especially smog, those 2 men played an important role in the committee. But I got on the committee as a new member, even though it was a choice committee. But in 1974, there were so many new members, because it was the first election after the Watergate scandal, that there were a lot of openings, and I was able to get on the committee right away. Newer members after that had to wait a term or 2 before they even got on the committee. When the chairman of the subcommittee left, I thought I could win the vote for the subcommittee chair. There were 2 people who were senior to me, and seniority was very important. One was senior, but also a Democrat from Richmond, Virginia, who really was a Republican. Transition had not been made for Southern Democrats to go to the Republican Party, Northern Republicans, liberals to become Democrats. And I thought I could beat him because he was so out of step with the Democratic Party point of view. And this was a vote that would take place among the Democrats on the committee, full committee. The other Democrat ahead of me was Congressman Richardson Pryor from North Carolina. He was Mr. Ethics. He had been a judge. He was a fine person, liberal on civil rights. But when it came to issues like pharmaceutical issues, his family was the Richardson Merrill Pharmaceutical Company. And so his fortune was tied up in drug industry. And because he was from North Carolina, he insisted that smoking was not a health problem. I took him on both of those issues and campaigned to the Democrats. Was able to beat him by a narrow margin, but nevertheless enough of a margin so that I became chairman of the Health and Environment Subcommittee after only 2 terms. I then served, I think, 16 years as a chairman of the committee. So a lot of the legislation that I authored came out of that subcommittee, both on the environment and on healthcare.
So I guess when you were vying to become chairman, from what I understand, the 2 main issues that you fought were pressing at the time was really tobacco use and the cost of pharmaceuticals, or was there something else?
No, it wasn't the cost of pharmaceuticals. That was not a problem at that time, but the fact that he had a conflict of interest. If he were chairman of the committee that had jurisdiction over the Food and Drug Administration and his fortune was in pharmaceutical matters, that there's a conflict. Since he had been chairman of the ethics committee, it should have been obvious to him that was an ethical challenge. And I also argued to my colleagues that it wasn't a good idea for him to be chairman. He said he would recuse himself from pharmaceutical issues, but how do you act as chairman of the health subcommittee that has jurisdiction over the FDA and not participate in the issues that deal with the FDA? And secondly, even if he didn't actively participate, which was hard to believe, the people at FDA knew that he was the chairman of that committee and that if his company had issues before them, they would become overly concerned to placate him.
You have a great book about your time in Congress called The Waxman Report. I always find it interesting what's not in a book. So I noticed that the Hatch-Waxman Act isn't there, but a lot of the related characters and the themes are. So I just wanted to ask you about some of them. Obviously, another person who played a big role in the Hatch-Waxman Act is Senator Orrin Hatch. Do you remember when you first met him? What was his like? What was your impression? Did anything surprise you as your relationship went on?
Well, I first met him and dealt with him was in 1981. President Reagan had just come into office. Reagan wanted to take a lot of the health laws that were run by the federal government and make them into block grants, like the Medicaid program. Yeah. The Republicans are still trying to make that a block grant. They wanted to make that a block grant, and they wanted to eliminate programs like family planning, which they still want to do. They wanted to say, we'll give money to the states and let them use it as they saw fit. Of course, the problem with that is you give them a sum of money, and then the next year when you want to save some money, you give them less. And you tell the world it's their responsibility. If they don't have enough money, they just have to come up with more money themselves. It ends a lot of federal efforts. The Reagan budget passed the House and the Senate, but a different version passed in the House because we were able to work with the Republicans on our committee to come up with our own version of the law. So our version had to be reconciled with the Republican-dominated version, and Hatch was the chairman of the HELP committee at the time, the Health, Education, Labor Committee in the Senate, which was our counterpart on a number of the issues in the conference. Right. So I remember the first time we met, we were in a conference to try to work out these issues. But if they couldn't get me to agree, Democrats were nominally in charge in the House, even though we had been rolled by the Republicans and conservative Democrats in adopting their budget. If I didn't agree, then they couldn't pass the whole bill, and the budget would not succeed and become law. So I had a lot of leverage, and I had to work out things. One of the things I had to work out was I wanted to preserve the family planning program. Republicans were trying to get a special law passed so that Reagan's appointee as the Surgeon General, C. Everett Koop, could serve in that position. He needed a law passed, not just confirmation by the Senate. In fact, I don't even think in those days they had to be confirmed, but he couldn't take that position because he had to be in the health corps, and he was too old. So he needed a law to be passed specially to allow him to take that position. I didn't know him. I wasn't excited about him because the only claim to fame that he had at that point was that he was very much against abortion, and Reagan appointed him for that reason. And he was also a surgeon. We call it the Surgeon General, but that's a public health position, not a position to advise surgeons on how to do their job. So I saw no reason to help Dr. Koop become head of the Public Health Corps. So I blocked the bill, but now I said, okay, I'll go along with that bill, but you have to leave family planning and reauthorize it. And that became one of the trade-offs. It turned out to be one of the best deals I ever made because Dr. Koop turned out to be one of my heroes. He was strong in his views on opposing smoking, and he was very much for public health, a science-based approach in dealing with the AIDS epidemic, where a lot of people were panicked. He was a voice of sanity. We became good friends, but I never would have known it at the time. And he later said that he became friends with me even though he hated me for the longest period of time until I finally let the law go through to allow him to be Surgeon General.
So what was your impression of Senator Hatch?
That was the question.
Yeah.
Wasn't it about Senator Hatch? He would say, no, no, no. He was very hard to deal with. One of the senators on his committee, Dan Quayle, put a position on the table that was going to work, that was acceptable to almost everybody. Hatch was just saying no, 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 and being obstinate. And then finally, Senator Quayle spoke up and said, Orrin, let's just take this deal. And we finally resolved our differences. So I didn't have a real good feeling about Orrin Hatch, but as we worked together, we were able to do things in a way where he was able to win and I was able to win on a lot of issues. And the bill that bears our names, the Hatch-Waxman Act, was a good example of a bipartisan bill where we came together and passed the law, but there were a lot of laws that we passed. In fact, what the Orphan Drug Act, passed before the Hatch-Waxman Act, was designed in our committee to give incentives for development of drugs for people with rare diseases. Hatch had no real objection to that, but he said if there's a bill that's moving, he wanted some things on it, and he had a proposal to do a survey of the damage to people in the area, which included Utah, near the sites where they tested nuclear weapons and later came down with diseases. They would at least do a survey of how bad that damage was to people. It made sense to me, but it became a source where the Orphan Drug Act was possibly going to veto, not because of the Orphan Drug Act, but because of the Hatch attachment. Finally, we were able to do a lot of things to get the whole bill signed, and Hatch won, and we won.
In your discussion in the book of the Orphan Drug Act, I guess patents played a role in that as well. Do you remember when you became aware of patents and intellectual property issues? I guess what were your thoughts in general about the importance of patents?
Well, in the Orphan Drug Act, we didn't have jurisdiction over patents in our committee. That was in the Judiciary Committee. But we decided that the incentive to give to manufacturers of pharmaceuticals who might well lose money or not make a lot of money on drugs for people with rare diseases because they're small in population, we wanted to give them extra time over what we call exclusivity, patent exclusivity over their drugs so that they couldn't get a competitor even though if the patent expired, because we wanted them to be able to say, no, we've got a period of time when we can remake our investment and maybe make some profit. So we gave them a 7-year exclusivity period over and above their patents. Or an exclusivity, by the way, is better than a patent. Patents can be challenged and often are, but an exclusivity said that the FDA cannot approve a competitor drug. So they, in effect, had a monopoly for a longer period of time. That was the basis for the Orphan Drug Act. It wasn't dealing with the patent, but we gave the developer of the drug something like a patent and something even better than a patent, no competition for 7 years.
I guess apart from that, in general, do you remember when you started thinking about intellectual property issues or patents?
Well, I certainly was aware of patents. Okay. The Orphan Drug Act was as a result of a call that I got from a constituent who was suffering from Tourette syndrome. He called my office because I was his representative, and he said, there's no drug for me to deal with my Tourette syndrome. There's a drug called Haldol that I could get it overseas or in some other country, but it wasn't approved for use in the United States at that time. And he wanted to be able to use this drug, but it was seized from him when he tried to bring it into the United States. What do I do now, Congressman? So I had our staff look at it from a health point of view. There was a bill that one person had introduced to say the federal government should take over the research and development of drugs for rare diseases that might not be profitable because too few people would be buying the drug. And I came to a different conclusion. I said, well, we've got a vibrant pharmaceutical industry. Why don't we give them an extra incentive to do work in the area of what we called orphan drugs, because people who were suffering from these diseases felt like orphans. Right. Nobody was paying attention to them. We decided to do it using the existing system rather than creating a government system, and to give an incentive that was like a patent to stop competition and allow them to recoup as much money as they could, even if it wasn't going to be a blockbuster drug. The irony is that many of the orphan drugs are now blockbuster drugs. We didn't envision that at the time. We were trying to just give a clear incentive and a signal that they wouldn't lose money if they invested in developing a drug, or sometimes just developing a drug that was on the shelf, but they had not put out and made available because they didn't see that there was a sufficient market for the drug with a small population.
That's all very interesting. So I wanted to talk about the Hatch-Waxman Act itself. And obviously, I want to talk about it really to kind of try to understand how Congress works, in your words, how policy gets made. So maybe you could tell us a little bit of background. What was the pharmaceutical industry like at the time before the Hatch-Waxman Act passed? Did you see any problems at that point?
There was no pharma. It was the PMA, the Pharmaceutical Manufacturers Association, that represented the brand name drugs. There were very few generics on the market because the problem was to get a generic drug approved, even though it was the same drug that had been on the market when the patent was finished, the generic manufacturer had to go in and establish the safety and efficacy of the generic drug as if it were a new drug. But the generics were the same drug that had already been on the market. There was no difference with that between the generic and the brand. We were aware of that fact and wanted to get generic drugs approved on an abbreviated basis, to have an abbreviated new drug application where all they had to establish is that they were the same drug as the brand, and then they'd go automatically on the market as long as there wasn't a patent to stop them. We were aware of that problem, but in the year that we passed the Orphan Drug Act, the brand name drug companies were trying to get a law passed to give them more patent time. They argued that they had to give up some of the time that they couldn't reap any benefits from their drug under the patent because they were still being reviewed at the FDA. They wanted to restore the time at the FDA to their patent. That was a very popular bill. People weren't hearing any objection to it, and especially in the Judiciary Committee that had jurisdiction over patents. It passed the Senate, and it was before the House Judiciary Committee. Congressman Kastenmeier was the chairman. He was for the bill as well. They put it out of the committee, and I said, well, we shouldn't just give them this gift of a longer patent period without getting generic drugs as part of the bargain. But that was not on the table. So we had to defeat the patent extension bill by itself. And the way we did that was that they were so sure they had the votes, they put it on at the end of the session on a calendar called the suspension calendar. The bill could be passed by a vote of the House, but it had to be 2/3 vote, and no amendments could be offered. So they felt very confident that they would win, and they put it on the suspension calendar. A friend and colleague at the time was Congressman Al Gore from Tennessee, and we talked about it and said, this is really not a good bill for the consumers, because if they have a longer monopoly over this drug, they could just keep prices high for it, and there was no competitor that could come on the market, even at the end of the patent. So we rallied enough Democrats so that we had a third plus one of the House to stop the bill from passing on the suspension calendar. Yeah. It was the very end of the session, as I mentioned, which meant the bill could come back, but they had to get a rule to bring it up on the House floor. The chairman of the Rules Committee was a good friend of Al Gore's, another Southern Democrat who was liberal and had been pro-civil rights and was a friend of Al Gore's father. And so Al Gore went to him and talked to him and said, this is not a good bill because it's going to raise the prices of drugs. Don't give it a rule. And he agreed, and we only had a week or two and the session ended. When the new Congress came in, we put out a bill combining the two issues, giving a patent extension for the time lost, part of the time lost at FDA, and allowing generic drugs an abbreviated new drug application. So all they had to do was establish they were the same drug as the pioneer drug. And that was the bill we considered in our committee. The head of the Pharmaceutical Manufacturers Association in Washington thought that made sense. It was a good trade-off. He was a practical person, and he supported the bill and had some of his companies, I guess, go along with it. But after the Hatch-Waxman law was adopted, the brand name companies got angry because now they had competitive drugs, and so they threw him out. He later became the head of the Generic Drug Association. We went in with a bill that was supported by the Brand Drug Trade Association, and whatever there was of the Generic Drug Association, they were for it as well. And so we were able to get that bill through the House. When it got to the Senate, Senator Hatch wanted to make modifications on the bill. He was hearing from individual drug companies. They wanted a special carve out from the law for one reason or another. And we adapted some of the provisions of the House bill to do that, to get those companies on board and to get the senators on board as well. So that was the basis for the adoption of what was called the Hatch-Waxman Act. Not at that time. It became known as the Hatch-Waxman Act many years later when Hatch was the chairman again, because the Republicans had control of the Senate, a majority, and so people just called it the Hatch-Waxman Act, and that was fine with me.
So I wanted to delve into some of that. I think all of that is very interesting. So you were seen as an ally of generics at that time, and you were obviously aware of their problem. Do you remember how you became their ally, how you became concerned about their issues? Do you remember what prompted that?
From a consumer point of view, we wanted lower priced drugs to get on the market and compete. That was obvious to me. There were a couple people at the time who were very, very active, and I can't think of their names, but they were strongly for the generic drug industry. Jack Anderson, who was a columnist who took Drew Pearson's column many decades previously. And Jack Anderson was convinced that this made sense. He wanted generic drugs to compete. He was also a Mormon, as was Hatch. So they claimed that they had special entree to Senator Hatch. And so they did seem to have entree to Senator Hatch, and it helped him see the wisdom of the idea of this trade-off.
I was interested to learn that actually the idea of a patent term restoration actually came under President Carter. He had this domestic policy review, and it was one of the ideas proposed. Do you remember that? Were you consulted during that process about, you're the chairman of the committee, whether that's something that they should publicly recommend or not? How does it?
I don't remember that. That's interesting that they did. They didn't recommend a trade-off. No. They were only recommending it for the drug industry to give the brand name companies extra time on their patents. They saw it from the point of view only of giving incentives, but not from the point of view of getting competition. But that certainly laid the groundwork for the pharmaceutical industry to think they could get the patent extension without anything else. And as a result, they almost got it through before Al Gore and I were able to stop it.
And it seemed like besides the pharmaceutical companies, obviously there were some pretty powerful allies in terms of the universities, the research universities, the pharmaceutical industry, and so forth. And then it was you and Representative Al Gore at the time. How do you think you were able to overcome, I guess, the influence that all the stakeholders had?
We worked the floor of the House of Representatives and we contacted all of our colleagues, mainly the Democrats that were pro-consumer, and made the argument this was not a consumer bill. I'm sure that the consumer groups were against the bill as well, and we were able to convince enough Democrats that this is not a good idea. When something goes on the suspension calendar, it's supposed to be a consensus, and if it's controversial, a lot of people feel that it shouldn't go on the calendar, and we were able to say this is not a good bill by itself, and we should defeat it and bring it back and make it a better bill. And we were able to convince enough people.
And it seems that that suspension calendar, that failure for a patent term extension bill to pass was really a pinnacle point. I was reading about this, and there's some other theories besides you and Representative Al Gore lobbying that I wanted to run by you about why it failed. One of them was that there was fog at the airports and a lot of the congressmen couldn't make it to the vote. Do you remember that as being...
I don't remember that. I don't think it would have made a difference because what we needed were the progressive Democrats to be there. I just don't remember that day, but maybe.
I guess another theory was at the time, like Ralph Nader's groups and others were making a big, I guess, and I think you mentioned it about, they were talking about how much profits the pharmaceutical companies were making, and some of the progressive Democrats were unhappy about that. Do you remember that was a big concern, or was it really about the price of the drugs, or was it really people were unhappy about the profits?
The head of the Public Citizens, which was Ralph Nader's group that he established, who dealt with pharmaceutical issues, was Dr. Sidney Wolf. And he was very, very active on pharmaceutical issues and complained about the anti-consumer aspect of giving them more time on a patent. So I'm sure they were very, very active and very helpful in convincing enough people that they didn't want to vote for a bill that was supposed to be non-controversial, that was controversial to the consumer groups.
I think you touched upon it, but do you remember what actually prompted the two sides to start negotiating? Do you remember what finally brought you together to say, well, let's hash out a deal. And
in the next Congress,
yeah,
after the election, I was chairman of the subcommittee. I don't know if I was chairman when they tried to bring this proposal up by itself for a patent extension. I was chairman of the committee in the next Congress, and I put together a bill that brought together the compromise that would get generics on the market and also give extension of the patents for some of the time lost at FDA. I don't know if companies were talking about that at that time, but since the bill had to go through my subcommittee, I think they were all trying to figure out, well, if the chairman's for this, it may happen. Let's try to work together and get the best bill possible for both sides.
Someone who played a big role was Peter Hutt, and I guess he was the primary negotiator for PMA, and he said that he had no leverage after the loss in the House vote, and he said that negotiating with you was one of the worst experiences of his career. Uh-huh. Does that stand out to you? Are you surprised by that? Or
I'm honored to hear it. I have a high regard for him. He's a very forceful advocate for the pharmaceutical industry, and he was always a person we had to get around. But they did not have leverage after that loss. And when I was chairman of the subcommittee, and so they wanted the patent extension, they realized they were going to have to pay a price for it.
Another thing that surprised me about hearing him say that is that was it common for congressmen to negotiate directly with, I guess, representatives of the opposing side? Is that dynamic common, or is it usually you're negotiating with other congressmen who are aligned with them? How does that, from a practical standpoint?
That's a very good question. Obviously, we have to get the Congress members who vote in line with a compromise, but they're certainly influenced by the outside group that's going to be affected. So if outside interests negotiate a deal, usually members of Congress are happy to go along with it. Yeah. In fact, sometimes members of Congress will say, here's a problem, you go work it out, and if you work it out, we'll pass the legislation. We didn't quite put it that way. We were hearing from outside groups. We are talking to the outside groups. We are talking to the members, but ultimately it's the pharmaceutical industry that had to sign off of the bill, as well as the generic drug industry. There were two generic drug groups, and one liked the bill and the other didn't. But I think the one that did like it was the stronger of the two, and they had more influence on that side of the equation. But the drug companies, brand companies, that were the Pharmaceutical Manufacturers Association, that association bought into the idea of this trade-off.
And finally, you and Senator Hatch were able to work out a deal. One thing that I found interesting that in your book, you say when you first joined Congress, you were surprised by how everybody on the committee was able to participate in the process at that time. It seemed like after you and Senator Hatch worked out a deal, some people were unhappy and thought it was kind of rushed through. Did Congress change at that point? Or maybe you had a different sense about how that ended up happening?
A lot of the legislation that I authored took many years to pass.
Yeah.
And so there were different Congresses involved and some of the same players, but different people could be involved if, let's say, the Senate went from Democratic control to Republican control, or in the House, if the party switches. But this was, once we started working on the legislation, done within the same Congress. And so we had the same participants in it. We worked on the bill. We negotiated it in our committee. We talked to the outside forces. We lined up people. But whenever there's a complicated piece of legislation or a controversial piece of legislation, groups that might give you a green light if they don't actively support it will say, I'll support the House bill.
Right.
But then they'll go and lobby the Senate for a different version or more to their liking. And so a lot of the drug companies were lobbying the Senate to try to change the bill over there. And Senator Hatch listened very carefully to a lot of the drug companies who made their case that there ought to be some changes for drugs that were in the pipeline. They ought to be given a little extra time. If the drug was FDA, maybe they should get more time rather than the time we were specifying for a drug that hadn't gone yet to FDA. So there are all these circumstances that really reflected a particular company's strong financial interests.
Right.
And so we negotiated a lot of those things in the Senate. But the framework of the bill was passed in the House.
And it seemed by the end, there were these still big pharmaceutical companies opposed to the bill, but they came around by the end, and it passed the House, I think, 362 to 0, and by a voice vote in the Senate, the final Hatch-Waxman Act. Were you surprised by that final result? Because obviously it took many years and there was a lot of heated disagreement, but finally it was an overwhelming, I guess.
This wasn't so unusual in my legislative career. There are a lot of bills, for example, the Clean Air Act, that was a huge battle for 10 years. And every 2 years, I would introduce a new version of the law, but I couldn't get it passed. And I kept on trying to enlist possible coalition that could get it through. But by the time it passed in 1990, we had worked out enough of the problems so that interest groups that were opposed to it decided that it was going to get harder for them if we didn't pass it, or they saw things in there they liked and they wanted to just get the issue resolved. So that's not unusual. And it went to the House and the Senate for votes, and it was overwhelmingly passed in both houses. The Hatch-Waxman Act was another one where if a senator wasn't familiar, a congressman wasn't familiar with the details of this law, if they saw that everybody was for it, why would they vote against it?
Something else that was interesting about what you described was that one of the reasons you were able to stop the House Patent Restoration Act from passing was because, I guess, Al Gore had an ally who was the chair of the Rules Committee. I'd imagine these days, everybody thinks the chair of the Rules Committee is really controlled by the leadership. Was it different back then?
No, it was certainly the same back then because changes in the Congress, the biggest fight was at a time when Democrats seemed to have perpetual majorities. But the Democrats who became chairmen of committees were often the Southern Democrats because the chairs of the committees went almost strictly on seniority, and they had the safe seats in the South. And they were often reelected in their states or in their districts in the South because they voted more along the lines of what the Republicans wanted. And the chairman of the Rules Committee particularly was known as Judge Smith, was so strongly against civil rights legislation that even when the committees that had jurisdiction over the civil rights laws voted for them, he wouldn't give them a rule. He wouldn't even convene his committee to give them a rule to go to the House floor. So when President Kennedy took office, he worked to change that. And there was a huge fight because to change the rules, it wasn't the majority party, it was the whole House. And there had to be a coalition of Democrats and Republicans. And the rules change they had was that the seniority system was not automatic. And the chairman of the Rules Committee had to have the vote of the majority caucus to take that position. And Judge Smith eventually left or gave in to the majority party, which was the basis for him becoming chairman of the committee because he was in the majority. But not until those rules were changed did we have a chance to bring bills up. The Rules Committee did become and still is a vehicle for the leadership. But I don't think that Tip O'Neill was against what we wanted to do. And he wasn't going to fight with his rules chairman in the last week or two of the legislative session. And if the chairman of the Rules Committee, who was his ally, said that he didn't want to give a rule to this, there's not enough time, or whatever reason he gave, that was it. The clock ran out on the Pharmaceutical Manufacturers Association's effort to get a rule and bring the bill up.
I think you mentioned at the end of a process, Senator Hatch tried to bring as many of the pharmaceutical companies on board as possible to support the Hatch-Waxman Act. What was your opinion of the final compromise? Did you think it was a win-win? Were there things at the time that you would have liked to be different?
I watched carefully what changes he wanted to do for the drug companies. And sometimes our staff would talk to his staff about possible compromises if he felt he wanted to do something in a certain area so that we could have a bill that we all could support. I'm sure that there were compromises, not issues that were resolved the way I would have liked them, but they were resolved in a way that we felt we had to do in order to get the law passed.
In retrospect, looking 30 years later, did Hatch-Waxman Act work out the way you thought it would? Is there anything that you wished was different in that original act?
Well, in retrospect, there are things I would have done differently, but in matters that we didn't think about. For example, we didn't even think about biologic drugs because there were no biologic drugs. There were small molecule drugs, and the generic was the exact same drug. Well, now we're looking at drugs that are a lot more complicated. And to get generic versions of them, the FDA has to figure that they operate the same way in practice, not that they're exactly the same drug. A lot of these drugs are based on the process, not on the result. I mean, the result on the body is the same, but the drug has to be looked at in a different context. We didn't think about it. We didn't think about the 30-month stay and how much time that we gave to the generic drugs where a first generic blocked the other generics. We wanted to help the first generic to get on the market so that we could get a generic alternative on the market. So we gave the first generic extra time, which meant that we never thought of it, but meant the brand name drug companies would talk to the generic manufacturer and agree to pay them not to go forward with that first generic, which blocked all the generic drugs that wanted to come on the market as well. So there are things I would have changed, and there were things that we did change over the years in the Hatch-Waxman Act. So I probably would have done some things differently. But we got the essential of the trade-off of incentives for new drugs and the ability for generic drugs to be on the market. We wanted to give incentives through exclusivities along with the patent that drug companies would make the investment in a new drug and understand that by making the investment, they're going to recoup what a monopoly would bring them. But when that monopoly was over, we wanted competition on the market by getting a generic out there.
Are there any additional adjustments that you would make now?
I haven't thought about it. I'm sure there would be, but it's not going to happen just by my thinking about it.
I guess in 2011, Congress passed the American Invents Act, which created these new post-grant proceedings at the USPTO, which allows to invalidate patents. Senator Orrin Hatch, since that time, thinks, well, that really has the potential to disturb that delicate balance that you reached in Hatch-Waxman, because now generic companies really have two avenues to challenge pharma patents. One is through the Hatch-Waxman Act, and one is through those post-grant proceedings. He's proposed this new legislation to really make the generics choose one of those avenues. What do you think of that proposal?
I'm strongly against that proposal. When he introduced the bill in his press release, that it was something to improve the Hatch-Waxman Act, and I contacted him and said, it's not going to improve it according to Waxman, it may according to Hatch. And I even wrote a brief for the Commonwealth Foundation that they put out on the reasons I thought it was a bad idea. And I called Senator Hatch and told him that I thought this was a mistake. Every other patent holder could use the process at the patent office to challenge it and have it reviewed by the patent office. Supreme Court said it was illegal to do it that way. There was a challenge whether that could be justified. And since it was justified, we shouldn't say that generic drug manufacturers are the only interest group that couldn't challenge a patent at PTO. He may try to do this in the lame duck, but I hope he doesn't, and we'll be trying to dissuade him from doing it and vigorously opposing it if he tries.
I guess the concern is that there's a very high rate of invalidation overall at the PTAB, maybe not for pharmaceuticals, but overall. Does that concern you that maybe pharmaceutical companies won't invest as much in research and development because they don't know if their patents will be upheld or easily invalidated through these post-grant proceedings?
It complicates their business, but it doesn't invalidate the incentives that they get if they produce a drug that has a patent and an exclusivity. I don't think we ought to single out generics as the only ones that cannot use the PTO to resolve an issue. It's a quicker way to resolve an issue rather than have years and years and years of litigation where a generic is blocked from the market.
Going back to what you were saying about the orphan drug problem, I think you seem to recognize that sometimes the patent system doesn't even provide the necessary incentives for the pharmaceutical development when the market is too small. Similarly, a law professor, Erica Litzen, she talks about how some of the longest and hardest development that needs to take place for things like multiple sclerosis and Alzheimer's, the process is so long that whatever patents you might get really don't provide the necessary incentives for the investment. Do you think there's still a need for better incentives in any areas that the current patent system doesn't provide?
Well, I'm open to looking at that argument, but I can't quite see that with the very high prices of drugs that are rolled out as a new drug, that they're having a problem recouping their money. The biggest problem I see now is that we can have drugs for cancer or MS or anything else that people won't be able to afford. And so I want them to have the strong incentive to do research and development. But when they roll out a new drug, a newly patented drug that's in great demand, they can set whatever price they want. That is a huge problem. There are a lot of different possible solutions for the problem, but getting competition is, to me, the best way to hold the prices of drugs down. Otherwise, if you have a monopoly and you have a drug that people must have, there's no restraint on setting the price. There used to be restraint by companies that were very respectable, like Merck, who would never come in and use their their monopoly power to set such prices that it became unbearable for the payers, they felt a very strong responsibility. But now, a drug company, if it has the ability to keep on raising its prices and get higher profits, their shareholders are going to demand they take advantage of that opportunity, even if the management feels that may be gouging the consumer. So I think one of the biggest problems we have in holding down drug prices is for a brand new drug. And we recognize that's a problem, but that's not a problem we can do anything about unless we start changing the patent system. And I don't think there's an appetite to do that. What we're talking to members of the Congress about doing is to make sure that we get competition faster. A lot of these patents are renewed for very, very minor changes, and that blocks competition for longer than the patent period and longer than the exclusivity period. And when there's a monopoly, the owner of the monopoly can charge higher prices and can do whatever the market will bear. And that if it's a drug that's badly needed, the market will bear a lot. I understand the problem. I don't agree with the statement that they need more incentives than they already have for a new drug.
I guess I want to step aside from the pharmaceutical industries. There's companies out there that don't have any experience, but they don't like something that's happening in DC. What do you think is the most effective, first steps for a company to impact policy? And I can give you an example. For example, there's a software company that doesn't think there's the right incentives for it to invest in research and development for tools to help mental disabilities. What would you recommend the first steps? Hire a lobbying firm, form coalitions? What are the first steps that they should really try to?
I think that's a good question because I hear from a lot of people who have family members suffering from a very, very rare disease, and they don't think the Orphan Drug Act is sufficient for the incentives for their patients. So I think we ought to think through what else can be done. If it's a product that is approved by the FDA, they do have a monopoly over that product. And so we need to think through, is there some way we can help them get the financing? A lot of this has to do with the financing. If they don't see a huge profit potential, a lot of the investors don't want to go into that product. I don't know the case that you're raising, but I certainly would want...
But it's a hypothetical, yeah.
Oh, yeah. I was going to suggest that they contact our office. Yeah. If it's a situation where it's unique, they ought to get involved and contact the committees, contact the staff, and contact the people who do advocacy to see if they can get some help.
A long time ago, I read a book by Tom Coburn, Breach of Trust. So obviously he has a different view of how Congress works, but you and him write about a similar time period because he was there during the Gingrich era and he didn't think much good got done. You have a similar...
Yeah, but we also worked together. He came in. I had been very involved in, as you know from the book, HIV and AIDS.
Okay.
And he was on my committee.
Oh, interesting.
And he said, the response is just political. He's a doctor. We had to reauthorize the Ryan White Act. And so we worked together and he had some good ideas. He said we shouldn't be giving funds based on AIDS cases, but we should give funds based on HIV infections. We weren't quite ready to be able to figure out the number of HIV cases, and we had based it on AIDS because that's what we knew when we started the bill. But we transitioned that direction, which makes more sense.
Did it surprise you when he ran for Senate again? After, When
he ran again?
For Senate, after he retired from Congress, he ended up running.
Oh, I didn't remember the sequence.
Because I guess he was...
No, there was an opening for it. And then he realized he didn't want to do it anymore. But he and I were on the road together, giving speeches to groups where we would exchange points of view.
Oh, that's really cool.
And I like him.
Just two last questions, and hopefully they're fun questions. What advice would you give to somebody who wants to become the next Henry Waxman?
I had a couple of things going for me. I had a safe Democratic seat in Congress, and I didn't have to worry about re-election in the way that a lot of members do. I was given a green light to work on national and international issues because my district approved my doing it, and they wanted me to continue in office. So I knew that I could stay in the House for as long as I wanted, and I stayed there for 40 years. That also was an advantage. I wasn't looking for the next office to run for. I wanted to be in the House and try to impact policy so I could look at issues over a long term and not just what can I do in this year or the 2 years in a Congress. And that's an advantage because sometimes you need a period of time to get people to start looking at issues in different ways and thinking about different alternatives and being there to help them think about it. If the pharmaceutical manufacturers realized they had to make a deal because they couldn't get their patent extended without paying a price for it, and the price, of course, was getting competition from generics, it took them to realize that they needed to make that deal. When the biologic companies, the biotech companies, got together and wanted to say that if you develop a generic for these drugs, you had to give them 11 or 12 years of exclusivity. I can't remember the number, but I thought it was an outrageous amount of time. And I was opposed to it, but it was added on to the Affordable Care Act. And as much as I didn't want it, I didn't have time to fight it. And so I got defeated on that issue, and I thought I'd work out a compromise. And President Obama wanted to work out a compromise, and he was on my side. I thought this was too long a period of time for them to block competition. So there they were able to win. In other cases, they couldn't. They have to see how far they can go. And sometimes people figure, as I always did, better to take a half a loaf than nothing. Better to take 3/4 of a loaf than nothing. And so, or you lose one day and you come back and fight the next. So some of those issues are never fully resolved. If there's another potential Henry Waxman, stay there for the long haul. Keep fighting. Don't give up. Keep fighting and try to win people over with your arguments. And eventually, if you do that, you have a good chance to prevail.
That's all great advice. One last question. If you didn't become a congressman, any other career path that you might have wanted to pursue in retrospect?
Well, I went to law school. I became a lawyer. I didn't know what I wanted to do. I was more interested in politics and government, but you don't always have a chance to win an election. I was lucky enough to win and had good support, good friends and allies. But people have to figure out what they want to do. I probably would have practiced law in some form or another, but I didn't have to think about it because I was elected to office at 28, came to Congress at 35, and had many years ahead of me in a unique, fortunate situation where I developed seniority. I was able to get the committees I wanted, the chairmanships I wanted, subcommittees and full committees. So I was blessed with those extra opportunities to do the things I wanted to do.
Well, that's great how it worked out. Thank you so much for joining me.
Delighted to be with you. Thanks.